Hello everyone. This presentation I'm hoping that you'll find useful to help you be really successful in your OSCE assessment. So let's begin. So I think it's really important as students that you understand why you are doing the assessment item, because assessment items should clearly link with the subject objectives, and also it should feel relevant and as a stepping stone to where you hope to see yourself in clinical practice. So this assessment provides you with the opportunity to demonstrate application of knowledge and clinical reasoning skills gained during laboratory preparation and during your in-class activities and your in-class clinical scenarios. So what actually is involved? So you will be assessed on one of the three scenarios. You will be required to demonstrate person-centred care, including effective communication, safe administrations of medicines, clinical assessment, interpretation of findings, and your nursing practice. Now, these are all key attributes of a professional registered nurse, which is what we're aiming to help you achieve. We want you to be really work ready when you graduate, and I'm hoping that this assessment item will really provide you with insights into what you do well, what still you find challenging, but really the importance of practicing safely for patient outcomes. So on the day, you have been given a sign-in time, and I'm hoping that you've all checked the OSCE timetable. If your name is not on the OSCE timetable, can you please email me as a matter of urgency? There is 30 minutes before your OSCE session, so please make sure you still arrive at that sign-in time, because that allows the professional staff that are organising the OSCE to make sure that everybody's there and ready to go at the correct time to walk into the labs and perform their OSCE. It's really important that you have a professional appearance and appropriate footwear. So think about it as if it's your first day of clinical practice and you are going onto the clinical floor. Think about what the expectation is in your appearance, and please note, if you do not have appropriate footwear on, you will not be able to undertake your OSCE. Remember your student ID, as this will be checked at 2 points. It will be checked at check-in, so when you first arrive and sign in with the professional staff member, and also before you commence your OSCE within the laboratory, you're going to have to show your student ID card. What will I be asked to do? So you will be directed to your allocated lab and bed space, and this is where you will meet your marker and your ID will be checked again. You will then be given 10 minutes reading time, and that includes some patient information. The MIMS will be available for you, and you will also be required to sign the cover sheet. You will be able to write during this time, so you are able to make notes during this reading time. Please note though, any note taking that you do during this time will have to remain in the labs with your marker and cannot be taken outside of the labs. You will then be given 30 minutes to perform your OSCE, and this includes the administration of 8 o'clock medications, describing how you would conduct an HG assessment, interpreting the assessment findings, and providing 3 priority nursing actions and rationales. Once that 30 minutes has been completed, you will have 10 minutes to reflect on your performance and note take for your reflection paper at completion. So feedback on the day. So all marks, so for all students that perform their OSCE during OSCE week, all marks will be released Saturday afternoon after the completion of all that marking for that week. You will only receive a brief feedback on the day, but you will receive a voice comment via Turnitin so that you're able to listen, reflect and use this information for your reflective paper and for your future clinical practice. And this will also be available Saturday afternoon. You will be told on the day if your performance has been successful or unsuccessful. So what if you are unsuccessful? It's important to remember that an opportunity to retake the OSCE later during the session will be available, and that will be during the week commencing the 23rd of October and concluding the 27th of October 2017. If you are unsuccessful during your OSCE performance, please do not book anything during this week until you have your date and time confirmed. The second attempt will be a cap mark at a maximum of 50%. So let's have a look at the information that you've been provided. So this is available on MSN UTS Online site. It is under student information. So this is the student information that you've been given about the 3 patients. Remember, you will be asked to provide care to one of the 3 patients. If you look closely at each of the patients and you read their situation, and you will probably realise that they're quite similar to patients you've already cared for in the clinical laboratories. Patient 1, patient 2, patient 3 have similar presentations to patients that you've already undertaken scenarios to care for this type of condition in your labs so far this session. Patient 1, if you read patient 1, his name is Donald Baker and he's 70 years old. He actually has a diagnosis of community-acquired pneumonia. Patient 2 is Giorgio and he actually is day 1 post-op following a partial colectomy and formation of a colostomy, secondary to bowel cancer. And patient 3, this is a patient that's been transferred to the ward after he was diagnosed with a STEMI and he had a PCI performed. So these 3 patients are similar to patients you've already cared for, which is a great learning opportunity for you, because you can actually go back to patients that you've cared for in the labs that have been similar to these 3 patients and revise on the patient's pathophysiology, revise on that patient's care, and revise on some of the nursing actions that you needed to implement in relation to their care whilst practicing in the labs. You will be expected to do the following 4 elements to meet satisfactory in your OSCE. So you need to demonstrate the safe administration of an injectable medication that is due at 8 o'clock, and that injectable medication will be a subcutaneous route. It's also important to note to verbalise the medication calculation to determine the correct dose if this is required. You need to verbalise and perform a complete patient A to G assessment, and you may use the mannequin for demonstration, purely for pointing out areas that you may like to highlight to your marker. Please note that you're not asked to perform vital signs as such, so you will not be asked to actually do the blood pressure, take the pulse, or count the respiratory rate. What we were looking for is your ability to describe to the marker how you would actually perform an A to G assessment on a patient. Once you have completed your verbalisation of an A to G assessment to your marker, you'll be provided with the assessment findings on an A to G template. So the A to G template that's in your student booklet, that template will be the one that will be completed with your patient's current assessment findings. And as well as you will also be given a SAGO chart, so you'll be able to visualise their latest vital signs. Then you will need to take this information and let the marker know what is normal and abnormal on those findings. And then your marker will ask you to apply your pathophysiological knowledge to demonstrate your ability to link these abnormal findings with the patient's current condition. So what that means is your marker will be looking for your ability to be able to say what is happening in your patient's body to produce these signs and symptoms that are abnormal. The last part of the OSCE is you then have to describe 3 appropriate priority nursing actions that you will undertake and why. So remember, the nurse in action is what you're going to do and how you're going to do it, and the why is the rationale for your action. So why are you going to do what you're going to do? That is what will be expected of you during your OSCE 30 minutes of performance time. During your reading time, you'll be asked to sign a cover sheet, and this is a representation of that cover sheet. As you can see, there are no notes permitted to be brought into the OSCE, but the cover sheet is designed for you to state an agreement that you have not attempted to copy the examination content of this assessment item from another student enrolled in the subject, that you have not given a copy or shown a copy or discussed the exam content of this assessment item with another student enrolled in the subject. So what I mean by that is, it doesn't mean you can't practice with each other, you can't provide each other feedback, you can't come up with some ideas of how you may answer some questions, but it's actually, if you have performed your OSCE already and then you go out of your exam and you then tell the next person or your friends that are on the next day exactly what you had to do and the patient's current assessment findings, this is what this is referring to. Okay, and then if the reverse has happened and say you're on Friday but your friend was on Monday and your friend wants to tell you everything that they did in specific detail in relation to your OSCE, you have to have enough, you have to say no, I don't want to hear it, because that will place you in a compromising position as well. Okay, you also need to make sure that you declare that this assessment is your own work. So for example, you cannot have someone else try and attend your OSCE on your behalf. And this all falls under the student misconduct rule. So I'm sure this is quite familiar to you. This is standard processes that apply to all examinations. So that's just why that is there with, so you're just reminded that those are the requirements, because this is classified as a faculty exam. So let's have a look at the marking criteria. So this is page 1. So just so you're aware, marks will only be allocated based on the marking criteria. I've tried to make the marking criteria as specific as possible, so that means there's less chance for subjectivity, and also it means that we hopefully will get more consistency across all our markers for your experiences, because that's really important. So as you can see, it's quite straightforward. There's yes or no columns to start with. So either you do something or you didn't do it. So for example, the first 2 criterion is complies with uniform policy and has a professional appearance. So therefore you did do that or you didn't do that. Did you turn up in the professional appearance or did you not? So that's why it's quite straightforward in the initial part of yes or no. And it means did you do it or did you not? Let's look at the safe medication administration section. It is about checking that the order is legal, consulting the MIMS and correctly identifies the use for this medicine, contraindications, precautions, common adverse events, and interactions with other medicines. Okay, now, as I said, you're allowed to write during your reading time. So if, for example, you need to write some of these notes down from MIMS so that you're able to perform this step in your safe medication administrations, that is perfectly fine. You need to ensure that the route is the most appropriate for the patient and the medication prescribed. And this is all done before you even greet the patient. Now, sometimes things might happen in different orders. Please note that as long as you have completed these tasks, the marker will be able to prompt you to make sure that you keep moving forward. Please do not worry if, for example, you introduce yourself to the patient before you've checked the legal prescription. We're not, the marker's not looking for ways to trick you or to mark you, to not provide you with marks. So don't be worried if the order is a little bit different in this first section. But it's important to constantly verbalize to your marker. So talk out loud what you are doing so they have a clear understanding of your thought processes. So you must greet your patient. So as you can see, in this top section, there's either, it's 0.5 or 1 of a mark. Then here there is 2 marks allocated, and as you can see, this is because this part is quite important, because this is about where you inform the patient of the process and obtain consent, and you explain to the patient what the medication is, why they are administering it, and why you are administering it, and any possible side effects of the medication. So it's about taking this information here that you've described to your marker, but applying it in conversation to the patient using appropriate language that you would expect you would use for your patient that you were looking after. You need to determine correct site and conduct appropriate assessment of site, gather your equipment, do your first check as per the medication administration checklist, and also check the expiry and calculate and verbalize the correct dose. So what I mean by that is it doesn't necessarily, you may not need to actually do a full calculation, but you need to verbalize to your marker how you have determined that you're withdrawing the correct dose. So as you can see in this marking criteria, there is a safety fail criterion in relation to medication safety. So the following elements that are highlighted in criterion 14 are really important for you to pay attention to. So if 2 elements are admitted or performed incorrectly, you will receive a pass score only for medication safety. So that means you will receive a score of 4. If one of the bold text elements is admitted or performed incorrectly, you will receive an immediate score of 0 for the OSCE, and then you will be given another opportunity to attempt. So this is our first safety fail criterion. So if you have a look at the elements that are in bold text, these are the elements that if you admit them, so if you don't do them at all, or if you do them incorrectly, will result in you being unsuccessful for this OSCE attempt. The areas in bold are such: ensures appropriate gauge needle is attached to the syringe. So it's really important that before you inject your patient, you have the correct needle on the syringe. It's about making sure that you transport your medication safely to the patient's bedside. So you use your injection trays or kidney dishes. You do not walk around with a needle to the bedside. You check allergies prior to administration. And before you actually administer the medication, you perform the third check, and the second check by the RN is also performed at the bedside. Then the other 2 bold text elements are that you insert the needle and inject the medication appropriately. So what I mean by that is your actual injection technique is appropriate and that you've been able to inject the medication safely. The last bold element is discards the uncapped needle and attaches attached syringe into the proper reciprocal, and you do not recap. It is imperative that you do not recap the needle after administration, and you discard appropriately into the yellow bin. So that's that medication safety. The final part of administration of medications is performing the 6th rite. So you need to document and sign after the medication has been administered, and verbalise to the patient that you will return and recess post-medication administration. So that's the completion of your medication administration section. Then you move on to section 2, which is your description of how to perform and complete a patient A to G assessment. As you can see, it's airway, breathing, circulation, disability, exposure, and glucose. And these marks have been broken down into developed, developing, or poor. So poor would mean that you were unable to do the description or it was incorrect. Developing would mean that you had most of it correct. And developed, of course, would mean that you met the standards that's required of a second-year nursing grad student in relation to performing describing an A to G assessment. So just so you're aware, in your labs, for next week, which is Lab 6, we are actually going to do some OSCE practice. And what I'm going to provide for you in the next couple of days is actually the A to G table that we used in Lab 1. And I'm going to really highlight the parts that are going to be imperative for you to describe to meet the criteria for this assessment item. So I will try and give you, my way I approach learning for my students, and particularly in relation to assessment items, is that I believe that I will give you all the information that you need to be successful and do really well, because it would be great if you all are able to get really great marks in this assessment because you've all worked hard. So I would love to see lots of students receive really high marks for this assessment. So to do that, it's important that I provide you with the tools you need to do that. But then it's up to you as individuals to take that information and use it wisely and appropriately to aim for that success. So that will be something that I will give you to help as a learning tool and teaching aid for you to make sure you fully understand how to do that. If we look, the other thing that I'd like to just say in relation to describing your performance, another trick is to start talking out loud at home or with your fellow students and describing, out loud what you are doing and why you may be doing that. So things like, if you're cooking in the kitchen, just pretend that you are on one of those TV chefs and you talk out loud the steps that you're doing and the order that you're going to do them in and what you might be preparing and what you might be thinking and why you're going to do it. Get in the habit of talking out loud and describing what you see. So you might want to practice with each other, so describing what, if you were looking out your window at home, what you would see. This is all good tips and tools that you can use over the next week to really build up your skill about talking comfortably out loud to describe what you're thinking and to also describe your actions. Okay, so the next part, so once you've completed your description, the marker will hand you the A to G template with complete assessment findings for your patient, as well as the SAGO chart, and you then can review that and identify for the marker what is normal and what is abnormal. Again, marks have been broken down accordingly, and as you can see, you can refer to the marking criteria as to how those marks will be distributed. Oh, that's not our far. I didn't want to go that close. Oopsie. So, sorry about that. So let's have a look at 19, and if we can see, this is where the pathophysiological knowledge is really going to be critical. And based on the outcomes from last OSCE in autumn session, this is probably the section that that most students found the most challenging. As nurses, it's really important that we're able to understand what's happening in the patient's body. It's really great to be able to identify what's abnormal and what's normal in relation to signs and symptoms and findings on your assessment. However, it's even better if you can understand why your patient is showing those signs and symptoms, because then you can actually predict what will happen if you don't do anything, and also predict what actions are needed to help improve your patient's condition. So this is why it's really critical that you start making your links between your signs and symptoms and what is happening in the patient's body, and that is what this is asking. We're asking you to be able to link the abnormal findings to the patient's condition. The next part is then taking this information and thinking about your 3 appropriate priority nursing actions that are based on your interpretations of the findings. So what 3 things are you going to do, and what are the rationales? A clear tip is think about what most of our patients in our clinical laboratories have needed in relation to some nursing actions that you've cared for. A tip is majority of our patients have deteriorated because the overarching theme for this session is recognising and responding to deterioration and A to G assessment. So if you can think about, okay, what nursing actions have I had to describe or implement in my clinical scenarios during lab time in relation to my patient because they have been deteriorating. So think about those things. That's quite a big tip, and that will help you formalize some ideas and some rationales for what you may need to do for your patient, recommend needs to be done for your patient. Also remember that your nursing actions need to be clear. So it's what you're going to do and how you're going to do it. So if you're going to call a clinical review, you might say, I would call a clinical review based on X, Y, and Z findings. And I would do that by using ISBA as my communication tool. And my rationale is because X, Y, and Z. So can you understand that you are giving a complete answer this way? Again, marks are broken down accordingly. Please go over the details of that marking rubric so you're really clear on how to get full marks for that section. Then you have marks allocated for professionalism, and what I mean by that is, you know, did you demonstrate a person-centered approach by explaining procedures or actions or cares? You know, did you conduct yourself professionally through your actions and behaviours? So they're marks that will just are overall marks for your performance in that day, on that day. There are also marks allocated for infection control, your hand hygiene. So remember your 5 moments, please. There is either yes or no. So either you did all your 5 moments or you didn't. Standard precautions, non-tap technique, and asepsis maintained. Again, we've come back to yes or no responses for this. Either you did all your standard precautions or you didn't. You used non-touch technique or you didn't, or your aseptic technique was maintained or it wasn't. So those are the marks that are allocated there. And finally, we have one more safety fail criteria, and this of course falls under communication. The reason why communication is a safety fail criteria is because communication is our number one cause of errors and poor patient outcomes. Okay, so let's have a closer look. So if 2 elements are admitted or incorrect, so if you don't do 2 of these elements or you do them incorrectly, you will only receive a pass score in communication. If 3 or more elements are admitted or performed incorrectly, you will score 0 for OSCE and you will have to redo your OSCE during week commencing the 23rd of October. So therefore, have a close look at the elements. So we've got clearly spoken, appropriate volume voice, uses appropriate pronunciation and grammar, uses appropriate clinical terminology. So what that means is, so you don't say, oh, it's got an increased heart rate. We want to hear the words. If he is tachycardic, so if he is over 100 beats per minute, then you say he's tachycardic. If he's tachypneic, so if his respiratory rate is elevated, or is he hypotensive or hypertensive, not high or low blood pressure. So what we're trying to get you to use that correct clinical terminology. So that's something that some of you may need to keep developing and working on over the next little while. Demonstrates clear listening and understanding on what's being asked and uses appropriate body language. So these are the components we're looking for safe communication. So therefore, if 3 of these elements or more are admitted, so if you don't do 3 of these or you perform them incorrectly, you will receive a score of 0 for your OSCE and you will be offered a reattempt. So your OSCE is out of 50. So the marking criteria totals 50 and your marker will provide comments to you. As I said, they'll give you brief comment on the day, but they will give you a verbal comment via Turnitin as well. So that will help understand how you went. But because it's quite a detailed marking criteria, you'll know exactly what you did and what you didn't do and where your areas may need to be strengthened. There is the yellow zone, here is the yellow zone. I'm not going to go through these slides. This is available for you on UTS Online. It's on one of the tabs, I think it's called Know Your Red and Yellow Zones. Maybe it may be a good idea just to revisit those in case you need some clear understanding of some actions that need to be performed. But a good place to start for actions is, what did you do in your clinical labs when your patient was deteriorating? So timing. There will be a timer projected with a voiceover. So you will be able to, there will be a timer in the classroom, in the lab, and it will tell you when to start, when to stop, and give you some 5-minute warnings. Please note that any activity performed by you outside of the allocated time will not be assessed. So if, for example, you run out of time and you don't get everything done in the performance time of 30 minutes, unfortunately that will not be taken into account into your assessment item marking. So remember to verbalise what you are doing throughout your OSCE. And if you make a mistake, what can you do? If you make a mistake, you should tell the marker within the assessment time. Share what you would do to correct it with your marker, and this will definitely be taken into account. However, please note that verbalisation will not necessarily overturn a critical fail. So if you've done something that could place the patient in danger, even though you've recognised your mistake, it will not necessarily mean that you will not that the decision for a first attempt fail will be overturned. Okay, so just keep that in mind. So best of luck from all of us on the MSN team. I think that if you just take time to really have a good look at the patients so you can become re-familiar with them, revise them, the work that you did with them during the clinical labs. Think about that some of them had, one of them had a chapter reading, I think that was quite helpful for determining patient nursing actions, and keep revising and practicing. So you want to practice your subcutaneous injections using the checklist that is being provided in your student booklet. This is the same checklist that will be used on placement as well, so your facilitators are very aware of this checklist as well. Your A to G assessment, as I said, I will provide you with some further guidelines into what to verbalise to your marker, but what I really want you to do is go back to that look, listen, feel and become really familiar with it. Do A to G assessments on your family, A to G assessments on each other. Just talk about how you would do it, verbalise it, talk out loud, practice. Become really comfortable with your voice, because that's going to make a difference when you perform. It will actually take one level of stress off because you feel comfortable to do that. So all the best. If you have any questions, please post them on discussion board on UTS Online, and I will respond. If you feel that it's more personal, please email me, so that way we can have a private correspondence. Lab 6, you will be doing some practice. It will not be one of the patients that you will be looking after, because that will be slightly unfair, because then other students may not get that patient in the OSCE, but it will be a situation created so you can practice the skills of subcutaneous injection, describing an A to G assessment, interpretation of findings. So all the best, and I think that you're all going to do fantastically well, and I will see you soon.